Welcome, everyone. We are very glad to see all of you logging in here. This is Live with Dr. McDougall that we do every week, and most of the weeks Dr. McDougall is here, but sometimes we have guests. And I am Gustavo Tolosa. I'm the webinar coordinator for Dr. McDougall. And I've decided to call myself the plant-powered pianist, which is 3 P's, P at the third power. Okay, so that's my new name. And for those of you that are new, I just want to say just a couple of words about Dr. McDougall. He's a physician that practices conventional medicine, and he uses conventional drugs or conventional procedures whenever they're necessary, but also he treats diseases that are based or caused by dietary, by food, basically, with food. And so Dr. McDougall is extremely successful. He has been treating patients for over 40 years, and he is the founder of the McDougall Health and Medical Center in Santa Rosa, California. And I, together with everybody that's logging in here, are extremely thankful for him giving his time that is very valuable and very limited, because it's, my goodness, such a busy man, every week to be here with us. And to my knowledge, I don't know of any other doctor out there that is doing these weekly webinars, and I mean every single week, for you all, for your benefits, without charging a single penny. So Dr. McDougall, thank you so much for being here today, and thank you for always making the time and answering questions. And how are you doing over there in wonderful Santa Rosa, California?
I'm doing great. I'm doing great. Yeah. I'd have to say probably better every day.
Yeah, you look great.
Yeah, well, I feel good. And I have to say also that every week when I tune in to see you, Gustavo, you look trimmer and healthier. I mean, what is it like? It's over 70 pounds now, isn't it?
Oh yeah, well, it's over now. Yes, I'm working to get to the 80 mark, and yeah, but it's fun. It's wonderful. I love it, and I will do it forever. And it looks like today, without wanting, we have coordinated colors, right?
Yeah, we didn't plan this.
We did not plan it.
You look more professional than I do with your coat. Next time I'll get a coat and tie on, then I'll show you.
That's right. That's right. Just that from here, I usually run out to my music studio and I start teaching it, and I like to look a little more, respectful.
Yeah. Well, after our hour here, I'm going to do a Skype talk with somebody in Israel.
Oh.
And I did one yesterday in Australia. I have a chance to do these all over the world, and of course, they're all free. I do them for free for people. So just trying to get the word out worldwide, and so the interest is huge all over the world.
I know.
And it's important. I think we're reaching a time when the average citizen understands that this is about business, and unfortunately, the dirty business of the food industry is killing your spouses and your children and your parents, and is causing unaffordable health care in this country, and it's destroying the planet. And the average citizen is finding this out. I hope to have been able to say there are no more global warming deniers, but there still are those out there. And I'm not going to get political, but you know who they are. And there are also people who deny the importance of a healthy diet and don't understand that our nature, our tradition, has been people of starch. People have eaten starch throughout, I can take you back probably 2.5 million years, certainly more than 100,000 years to prove to you that people were starch eaters. There's no dissension in this. There's no scientific research published in any respectable journal that says other than our ancestors were primarily starch eaters of one grain or one root vegetable or another. You can find me nothing else to say otherwise, except you can point to a few isolated populations of people who live on the extremes of the environment, such as the Inuit Eskimo, who I've addressed in my newsletters. And you can read, of course, just go to my website and use the search engine, which is phenomenal. Once you get past the few ads that that Google requires, then you get into some real serious, very well done research. So anything you have questions about, diabetes, arthritis, Eskimos, whatever you have questions about, if you just go there and give me a chance and hit the search engine and put in your terms, I think you'll be very pleased with the articles that come up in the order they come up in. But anyway, there are a couple of things that happen, or maybe they're tied together.
McDougall, why don't you tell us, first of all, about this really great news that you had, this invitation to be on a show. Can you just mention?
Oh yeah, I hate to. It's almost like knocking on wood for bad luck. But I'm scheduled to film on Dr. Oz on September 27th, which means the show will be out 3 or 4 days later. That's what they tell me. But I'll give you some updates, and hopefully you're on the newsletter list, and I can send you a notice as to when I'll be on Dr. Oz's show. I should have been a long time ago, for lots of reasons. And I told my publicist this too, and hopefully this doesn't get back as an offensive statement to their publicity people and those that are doing the programming. But Dr. Oz really needs me on his show. He's represented so many things that are untrue, ineffective, and industry-based. In fact, he's even been called before our Congress to answer some of the messages he's given to the public about the miracle cures. And he's also given undue advantage to the low carbers. I have not had the chance to count up the shows, but I have no doubt that people who represent low carbohydrate diets have gotten better representation than we have. The exception would be Dr. Joel Furman. He's gotten some pretty good representation on the show. But otherwise, Colin Campbell and Esselstyn have been on once many years ago for Forks Over Knives. He really owes the other side a chance to speak, and I'm going to have that chance to speak on the 27th of September. At least that's when we film. And I've asked for more than 7 minutes, but if all I get is my 7 minutes, then that's what I get is 7 minutes. Maybe I can further a friendship. Dr. Oz has been aware of me for a long time. His wife is vegan. There are some other things about his personal family life that I could convey, but I think it would be beyond appropriate to do that. But I just do say that I have an association with him that goes deeper than the average guest, and so hopefully they'll find it worthwhile to give me more than 7 minutes. But if they don't, I'll tell you, I'm going to tear whatever I can in those 7 minutes. I'm going to give him the run of his life in those 7 minutes.
I think you need the entire show, actually. But anyway, you'll get there.
I just did an interview for Cosmopolitan magazine yesterday, so we're getting a lot of publicity thanks to Harper One for the new book, which, by the way, happens to come out on the 27th of September.
Right. What a coincidence. Very good. Order it
now, the healthiest diet on the planet. You'll like it. I would tell you, if it wasn't a proud addition to our family of books. We have 12 national best-selling books. Everyone I feel about this or that book like I would my children or grandchildren. I love them all, and they're all different. And this likewise makes a huge contribution, mainly because Mary has color pictures for her recipes in it, and because I have Dr. McDougall's color picture book on food poisoning as a centerpiece. And Harper One's turned out to be a pretty amazing company, which is HarperCollins, and getting us publicity and really working hard. Rodale, who was my last publisher, did this. The starch solution was not too helpful, unfortunately. They were busy with wheat belly, and so I had pretty much all the sales that I got, which were pretty tremendous. We paid off our advances, and we're selling the starch solution worldwide. Publishers are picking it up all over the world. So the book has done very well, in spite of the fact that it got too little help from Rodale for whatever reason. And it continues. If you look up starch solution on Google Trends, you'll see that it continues to increase in sales as time goes on. That's by word of mouth.
Right.
With the extra help of Harper One now, who knows what the limits are. I certainly am not too tired to do the job. So if it comes up, I'll do it. Anyway, that's good, and you'll enjoy the new book. And let's see, we're running Well, we're having the advanced study weekend in a couple of weeks. You ought to come to that.
Right,
September 16th through 18th. But otherwise, we're not having another public program, 10-day program, until December 10. I think it's December, no, maybe December 2. And that's because we're doing several corporate programs for big companies. But our last program was very successful. We had 46 people with all kinds of problems, from breast cancer to diabetes to rheumatoid arthritis. And you know, the nice thing about the practice that I have, and Dr. Anthony Lim gets to share in that, and so do the students. We have medical students and residents that come and train with us. And by the way, our foundation pays for that, pays for the transportation and everything else for the learning doctors to come. But the thing that I kind of hint at when a program starts, and Anthony Lim, who is our medical director, knows this very well because he's been working with us for more than a year. But I kind of hint to the students, you're going to see something unique during this 10 days. And that is, you're going to see happy people, happy patients, that you don't see in a general medical office. Patients aren't happy because they get a bag full of drugs and a bunch of excuses, and they get through, you know, ping-ponged around the medical business with all kinds of specialists and tests and harmful tests and treatments and so on. Mm-hmm. They're not happy. But in our practice, as the students well saw, and as all of our staff sees, that's why we enjoy doing the program so much, is people are just plain and simple happy, often to tears. Which brings me to the last newsletter that we just published a couple of days ago, a tribute to Dr. Roy Swank, one of my mentors, one of my friends, one of my colleagues. Dr. Roy Swank was head of neurology at Oregon Health and Science University. That's the medical school in Portland, for 23 years. He's published over 170 papers. He's famous for the Swank filter, which made millions and millions of dollars for Oregon Health and Science University. It was a blood filter that saved lives by filtering particles out of the blood. But what he's best known for and most proud of is his work on diet and multiple sclerosis, which I've written on many times. If you go to my website, you'll find a whole section on multiple sclerosis, and most of it is about Dr. Swank's work and the things that I've learned from him. And what I did is another tribute to Dr. Swank. I did it with a new interview that almost no one has seen. It was done by the Swank Foundation, the Roy Swank MS Foundation. And they filmed it, paid for it, and they gave me permission to show it on my website. And also, I put it in my newsletter, and it's about a 40-minute interview with one of the geniuses of the 20th century. Dr. Swank knew about the things that I'm trying to teach you. He knew about them in the 1940s and early 1950s. And he published in our major medical journals how diet will stop multiple sclerosis. And it was his support, his knowledge, the work that he did that has been the foundation for me to try and tell you about the importance of diet and multiple sclerosis, and also was the reason that we raised nearly $700,000 to do a study. It was just, actually, it hasn't been published yet officially. It gets published September 16th in Multiple Sclerosis and Related Disorders Journal. But it has pre-publication, so you can find it on the internet, or you can find it in the newsletter, a link to it, so it's up there. And Oregon Health and Science University paid an extra $3,000 to make it available now, as opposed to a year from now. So it's free and available for you to read the study that we did. Now, we spent $700,000 on this, but that's nothing. That's nothing. That's less money than it costs to treat one patient with multiple sclerosis for 10 years. The drugs alone are about $75,000 a year. So multiply that by 10. So the amount of money spent to take care of one patient, there are 350,000 people with MS in the United States at least. So to treat one patient with MS for 10 years is the amount of money we spent on this study. And we got some great results. Not everything we'd hoped for, but I explain in the newsletter why we didn't get more. And I can tell you for sure, the staff at Oregon Health and Science University, they're very much behind the dietary treatment of multiple sclerosis. When we're talking about happy, Dr. Dennis Bourdette, who's now chair of the Department of Oregon Health and Science University Neurology Department. He told me, whether it was confidential or not, I think it's worth sharing to you. He said no patient had ever thanked him for giving traditional multiple sclerosis drugs like interferon beta or Copaxone. They'd never thanked him. He said, well, dealing with our patients, which were about 60 in number, he said people were in tears of joy and gratitude when they came to his office for the chance to learn about a healthy diet and the results they get. Phenomenal results, lost 60, 80 pounds, stopped their attacks, felt phenomenal. I mean, as far as individual cases go, you can't argue with it. There are so many of them. Even as far as numbers go, we had advantages over the control group. It just didn't reach statistical advantage like it should have, and that's because of randomization, which unfairly biased our study to not show good results. And you can read all that in the newsletter. But most importantly, if you just have some time, you have a few minutes between watching your favorite serial on TV or whatever else you're doing, just sit down and get to know one of my mentors and one of my friends. He ran 2 MS programs with me at my clinic at St. Helena Hospital during the 90s. And a person whose shoulders I solidly stand on, and make it clear the importance of diet, not only in MS, but other diseases. And so that's on this last month's newsletter. Also, a lot of really great recipes on that.
Yes, I saw that in the newsletter. Their second page here.
Yeah,
there's the link to watch the video. So that's great.
And you see the recipes here. I'm sorry, I forgot who did them. Can you tell us who did the recipes?
Oh, yes. This is one of the guests that we had last week for the school lunch kids, and her name is Emma Roche.
Oh, okay. Emma did them. Yeah, right. Thank you. Yeah, I just can't keep up with everything. Mary and Heather keep up with them. Yeah. So there are great new recipes there.
Very good.
Let's see. Okay, go ahead.
You were going to mention about the government buying cheese and eggs.
Yeah, a couple of things came out this month. One, this is from the Smithsonian.com. I'm sure it's every place, but you can look it up. It's about the U.S. government buying tons of eggs and cheese. The U.S. government's been doing this for a long time, and in fact, it's based on an Agricultural Act of 1935, which allows the Secretary of Agriculture to buy up excess domestic products. Well, they've been doing it in big time lately for the egg and dairy industries. And they bought $12 million worth of eggs and egg-based products. They're going to do that next year. I don't see where they say how much dairy, but they just buy millions of dollars worth of dairy too. And then what they do, unfortunately, is they take this dairy, excess meat that they get, excess eggs that they get, and then they feed it to the food bank programs and food stamp programs and other needy people in assistance. You say, well, that's great, they get food. Yeah, but they get food that makes them fat and sick. And then what they have to do is they have to go to the doctor in the hospital, and then because of their financial situation, their medical care is paid for by, guess who? You and I. It's paid for by the taxpayers. So we hurt, by doing this, we hurt the people that are supposed to benefit, those that need more food. And we hurt our healthcare system, and we hurt our average citizens and taxpayers. And we hurt the world, of course, by encouraging the production of more livestock, which is a major contributor and the most important contributor to man-made global warming. And anyway, that came out in the news. And the other thing that came out, it was kind of interesting, if you want to look it up, it's from the Canadian Medical Association Journal. And it says it was published May 30th, 2016. I'll just kind of show it to you here if you want to freeze on it and look at it. It's about a campaign by the Canadian government, federal funding for dairy research by the Canadian government. And the funding that they're buying the Canadian government is to study the impact of dairy fat on cardiovascular health in humans. Some of the statements from the government officials is the reason for the research is to help maintain consumer confidence in the nutritional value of dairy products. Did you hear that? The purpose of the research is to help maintain consumer confidence in the health of dairy products. That's the Canadian government officials paying for research. The intention is to help maintain consumer confidence. And also another official from the Canadian government says to improve our understanding of the nutritional value and health benefits of milk products. So the Canadian government starts out funding studies with those intentions to improve the consumer's impression about the health benefits of dairy products. Now, where do you think that research is going to go? Yes, and researchers who ask for funds, which is $13 million from the Canadian government, $5.3 million from dairy farmers, another $750,000 from the Dairy Commission to pay for research in Canada. Now, when somebody applies for a research grant, what do you think they're going to, from people who are benefiting from the dairy industry, what do you think that everybody expects to show? And if you don't bother applying next year, because you're not going to get a grant. This is what Michelson, who published in the British Medical Journal, said. He published a journal in the British Medical Journal, Michelson. Spelling you'll see in that article. He published that they found that high milk intake was associated with higher mortality in both men and women, and also with higher incidence of fractures in women. He said, industry-sponsored researcher who does not render appropriate results isn't likely to see funding prolonged. Do you understand, ladies and gentlemen? This is all about buying research. 70% of research on food is tainted by industry. And then that research not only gets published in journals, which are owned by industry, they also get spun by the media. And that's why they make national headlines in the Wall Street Journal, and the New York Times, and all over the world. When a study comes out that shows a positive effect of beef or dairy or eggs that was paid for by the dairy industry, published in a journal owned by the dairy industry or the meat industry or other industries of food. And then they take their PR people and they spin it so that everybody hears about it. And you wonder why your friends and relatives are confused. Marian Nessel, author of Food Politics, and also one of our guest speakers at an advanced study weekend about 2 years ago. She said of 168 studies that came across her desk between March of 2015 and March of 2016, 168 studies, only 12 results were unfavorable to industry. You just plain and simple don't stand a chance. Anyway, that was in the Canadian Medical Association Journal, as I say. The link I have is May 30th, 2016. I think that's probably freely available. Now, one other thing I wanted to do is people, I guess I didn't give you the reference, where I tried to tell you that simple sugar has been tested in terms of weight loss and cardiovascular. These are metabolic ward studies, the best studies that you can do, and the ones that you ought to be reading that aren't published by industry, and actually looked at the things that you care about. This was in the American Journal of Clinical Nutrition, which is also free for you. So you can just go to the American Journal of Clinical Nutrition. You can download this. I talked about it last week. It's in issue 65, page 908, 1997. And it's on the metabolic and behavioral effects of a high sucrose. Sucrose is table sugar. High sucrose diet during weight loss. It's a controlled trial, 2 groups. It's calorie restricted, which of course our program is not calorie restricted. And they found great weight loss in both. This was a 6-week study. They found an average weight loss, let's see, I got it here, of 6 kilograms. So that's like 14 pounds, an average weight loss of 6 weeks of feeding them a diet that was 71% carbohydrate, the diet was, 11% fat in both groups. It's just that one group got a very high intake of sucrose. The low sucrose diet contained 4% of the calories as white sugar. The high sucrose diet contained 43% of the calories as white sugar. In other words, 10 times as much was white sugar. In the low fructose sucrose diet, it was starch they used. But what they found is they found similar drops in weight, similar drops in cholesterol, basically everything was similar, including in both groups, and this is very important. They showed decreases in depression, hunger, negative mood, increase in vigilance, and positive mood with time. And I've told you over and over again that what you eat dramatically affects the way you feel in terms of your emotions. And it's been proved multiple very important research studies that when you eat a high animal food diet, it blocks the entrance of tryptophan, which is an important amino acid, in your nervous system. And tryptophan is the precursor of serotonin, and serotonin influences your mood in a very, very positive way. You remember 15, 20 years ago, they used to sell tryptophan as a antidepressant, and it was business and politics that got involved. The depression drug industry was very interested in not seeing the supplement being sold, and so it was basically taken off the market, which is fine with me. But what you need to know is the way to get tryptophan into your nervous system is to eat a low animal food diet. And what this study shows is just that, is that when they fed them, both groups, white sugar group, white table sugar, 43% of the calories, versus a low table sugar group, 4% of the calories, both 70% of the calories come from carbohydrate, either group. They showed tremendous improvements in mood, behavior, confidence. It makes a huge difference. And so this is one of the basic studies I talked about last week, and I guess I didn't give you adequate reference if you want to look it up. And having a few of these basic studies on hand helps when the food industry comes out and tells you how good it is to eat beef, and how important it is for your bones to consume calcium, and how bad eating starch is, and even how bad eating sugar is. Ladies and gentlemen, I've told you over and over again, sugar is not health food. White sugar rots teeth, causes nutritional imbalances. That's not what I recommend. I do think it's permissible and maybe advantageous to put a little white sugar on top of your starchy meals. You may be more likely to eat your oatmeal with a teaspoon of brown sugar, which is 16 calories, by the way. 16. That's not 60. That's 16. 16 calories. So we do use a little simple sugar on our foods, usually on the surface. As I've told you before, Mary Poppins movie, a little bit of sugar makes the medicine go down.
Right.
So anyway, you should not consider sugar health food, but you should not fear it. What's going on is this: is the food industry understands that the public knows that food is causing obesity and heart disease and diabetes. They know that. So what the food industry has done is they've thrown the sugar industry out as a scapegoat to take the attention off the meat and dairy. That's what they've done. And so they have their, I'm not trying to say they work for them directly, but they certainly do make them happy. Their proponents such as Andrew Weil, Robert Lustig, Grain Guide, David Perlmutter, William Davis, and so on, telling you that eating sugar is the problem. Well, it is a problem, but it's not the problem. And certainly starch is the answer, not the problem. It's the solution, but they mix up sugar with starch. And in the process of doing this, they take the focus of attention of lawmakers, school teachers, parents. They take it off what the real damaging culprits are, right, which is meat, dairy, and oil. And they had to throw something to the lions. Right. And so they threw sugar to the lions. And as a result, everybody misses the two elephants in the room: animal foods and oils. Well, maybe I'll get a chance to say that on Dr. Oz at the end.
Yeah, maybe you will. Well, it's a clever strategy that has been working, but I don't think, like you said, I think it's people are really getting the
well, they are. What PR involves is just taking people. It's introducing doubt. Right. There's a book about this, about the
yes,
power of doubt. You just have to introduce a little doubt in people's minds, and then they'll act contrary to what needs to be done, like with global warming and like with the food thing. So everybody knows people are fat and sick and getting fatter and sicker because of the food. So the element of doubt that's introduced is they tell them, what's the sugar? Well, everybody knows sugar's bad. I'm not denying that. But when you introduce that option of focusing totally on sugar, And these people that I mentioned and others with the low carb camp, they clearly tell you to eat as much meat and dairy and other animal foods as you can stuff in your face. And by the way, most of these people look like they do. Take a look at them. Oh, you know, if I ever got a chance, I would never get away with this, but just like I got fired from the Obesity Medicine Conference, if I ever got a chance to get on a big show with my opponents, I wouldn't hesitate to stand up and say, hey there, Dr. So-and-so, let's take off our jackets. And I'd even take off my shirt, and we'll show them what we're made of.
Right.
That would be the discussion, wouldn't it?
That would be the end of discussion.
Some of these people, like Robert Lustig, look like they're dying. Not just fat. They look like they're almost dead. And, you know, public, open your eyes and look at the people who are giving you the messages. And anyway, I guess that's probably all I should say.
Oh, well, that's been a good introduction, Dr. Max. Well, you mentioned before something that I think is worth repeating. Because the public doesn't start a chance nowadays with all these studies that are, you know, done by the industry, and unless it's something that comes from, I think you've mentioned, from the 1960s and 70s. Is that correct? Most of those studies.
This all started about 1980 when the McGovern report came out, the Dietary Goals for Americans in 1977. Industry realized in 1977, after the McGovern report came out on the dietary goals. And by the way, you can look this up on my website. Just go to the search engine and put in McGovern or dietary goals, and you'll find this article I wrote. What happened is industry saw what was going on, and that McGovern said that meat and dairy was killing America, and we should eat more grains, more whole foods, fruits, and vegetables. And this was a big deal. And so industry fought back with their lobbyists and all their money and got the entire guidelines rewritten by the end of 1977. And what they did is they learned from Luther Terry, who was the Surgeon General in 1964, wrote the Surgeon General's report on smoking and health in the U.S., the Surgeon General's report. The Surgeon General's report changed the United States and the world. Back in the 1970s, half the population, including myself, smoked cigarettes. Today, fewer than 20% of the people in the U.S. smoke cigarettes. So big food looked at what happened to big tobacco and said, it's not going to happen to us. And believe me, they have worked since the 1980s to buy research, buy researchers, buy journals, to buy everything they can to lie to the public, not to hurt you purposefully, but to keep their market share up, to keep business going. And they bought government, as I told you, they've got the USDA buying their excess products. It's just business. Don't take it personal.
Right.
Yeah.
Well, can we do some questions, Dr. McDougall?
Yeah, I'd like to do. I'd love to do that.
All right. Well, I have a few questions, and of course, people submit a lot of questions, and I apologize that I can't ask all of them because we would be here for at least 3 hours. But I do keep them. And you can always email them to webinar@drmcdougall.com, and I try to include them. So, Dr. McDougall, here's someone who's asking, in the last webinar that you did, I guess it was 2 weeks ago, about sugar, you said that a blood sugar between 150 and 250 is okay. Is that correct, or?
Well, no? that's with somebody with diabetes who's being treated with medication. You see, my goal, many doctors' goals, is to make their blood sugar normal. And that would be 100 milligrams per deciliter or less. Or you can measure it by hemoglobin A1C, which is the percent of hemoglobin that's glycosylated. And 6% is considered normal. The problem with trying to reach a daily blood sugar of 100 milligrams per deciliter or less is that you way too often go hypoglycemic. And this can be dangerous. It kills brain cells. You end up getting picked up by the police for a DUI or causing a traffic accident or falling down with these blood sugar reactions. They're extremely dangerous. So when your goal is 100 milligrams per deciliter, you're likely to reach these hypoglycemic levels. And that's why I recommend 150 milligrams per deciliter as the low when you're on medication. Off medication, you can have a blood sugar of 60 milligrams per deciliter. That's fine. In fact, there are healthy populations of the world that run, these are rural Africans that I'm thinking of, who run fasting blood sugars of 46 milligrams per deciliter in the morning. Off medication, there's no low limit. On medication, you have to be careful of hypoglycemia. So that's why I put it at 150. 250, well, people start worrying when it's 250 milligrams per deciliter. That's why I give them a range of 150 to 250. But I don't worry when it's 250. I don't worry when it's 350. You know, I know that I'm not doing them more harm than good when I make a target of, say, 250 or maybe even 350 as opposed to 50. You know, I'm sure 50 is more harmful than 350 as a target because of the hypoglycemia. Now, and this has been studied in 6 major studies, and you can find it on my website. It's in a 2009 newsletter I did on the easy treatment of diabetes. There are 6 major studies done. All of them show aggressive treatment of diabetes hurts patients. 3 published in 2008 in the New England Journal of Medicine were the last 3 studies that will ever be done using aggressive treatment. They were the Accord, the Advance, and the Veteran study. The Accord study was stopped 17 months early by the National Heart, Lung, and Blood Institute because of the increased risk of death and heart disease amongst the group that was aggressively treated. So they stopped the study early. The Advance study likewise showed no benefits, increased risk of hypoglycemia, no benefits in terms of cardiovascular disease. The Veteran study showed an increased risk of sudden death. Neither the Accord or the Veteran studies showed any real benefits in terms of protecting the eyes or kidneys. Just plain and simple, the research absolutely clearly says that aggressive treatment of diabetes kills. And as far as the benefits when it comes to, we're talking about large blood vessel disease like heart attacks and so on. When it comes to small blood vessel disease, I believe the evidence weighs against any important benefits from aggressively controlling blood sugars. And by the way, you can see that research if you go to my website and you look under Hot Topics Diabetes. I think it's the second or third article. I go over all of the microvascular research papers and show you that most of the modern big studies show no benefit in terms of aggressive treatment when it comes to the eyes and the kidneys and the nerves in type 2 diabetics. Right. So you're being lied to, ladies and gentlemen. And what you need to do, you see all this effort that's going into getting you to buy drugs and buy operations, and get hospital treatments and so on. All this money and effort should be properly displaced by education on how to eat well. I mean, if we were really concerned about our people in this country, we'd be putting out equal amounts or greater amounts of money into telling them, look, type 2 diabetes is 100% curable, 100% curable by weight loss. And the easiest, most sustained and healthiest way to lose weight is a starch-based diet. I mean, even surgery shows about 80% of people are cured by surgery of type 2 diabetes. So it's easy for me to claim 100% are cured. Now there's a spectrum here. There are people who have insulin insufficiency. We call it type 1.5 diabetes. And I quite type 1 where you have no insulin production. You have some insulin production, but not enough to keep things, quote, normal. And I treat those people with long-acting insulin, as I do type 1 diabetics I treat with insulin. So there's a lot to learn on my website if you want to know more about it, but that's why I recommend a blood sugar of 150 milligrams per deciliter or less fasting, because I don't want you to get hypoglycemic and seriously hurt yourself.
Mm-hmm. Very good, very good. Dr. McDougall, talking about educating the public, there is someone who wrote that said that they work for a government program that serves kids that are 0 to 5 years old, and they are required to follow the USDA food guidelines. And one thing that everyone in the birth to 3 year program believes is that babies' brains need cow's milk to develop properly. And this person says, I know this isn't true, but could you suggest what fats, if any, are important for baby brain development? We must provide dairy in this program, but I want to educate staff and hopefully change this one day.
Okay, first of all, using dairy as a recommendation for fat is exactly opposite of the truth. Cow's milk is 50% fat. Of that fat, 97% of it is saturated fat. In other words, it's not the polyunsaturated fat that's needed for brain development. So anybody who says you need cow's milk product for brain development doesn't understand the basic science and the basic nutritional components of dairy. 97% of the fat is unnecessary saturated fat, heart disease damaging type. So what may be an element of truth, but I don't believe so, is that children need extra polyunsaturated fat, omega-3 fats. And there have been multiple studies where children have been given concentrated DHA and EPA, which are two of the essential fats necessary for brain development. And these studies have not shown improvement in vision or cognitive function in children. So that plain and simple is a consensual lie. If you read the research, and I published some of that in the Starch Solution, and there's more you can find, is that the benefits of adding these quote necessary fats as free fats to babies and children is highly controversial, and I can show you clearly it weighs against benefits. You do need, a child's brain does need essential fat. Well, where does it get that fat from? It gets it from a food that's 50% fat. It's known as mother's milk. And when mother consumes a diet high in vegetables, she consumes a diet high in essential fat, because only plants make essential fats. No animal can make essential omega-3 fat. Only plants can. And so, animals can store essential fats, like fish can store elongated essential fat, ALA. But only plants can make it. So if a mom's eating a lot of plants, she's eating a lot of corn and potatoes and rice and beans and all the things that that mothers are supposed to eat and have eaten for millions of years. If she's eating those foods, then her body naturally is taking and making breast milk with a high concentration of essential fat for the baby's brain. So clearly, no one could argue successfully. I don't think anybody's foolish enough. Of course, I see some political people out there that are putting out some pretty foolish arguments. I'm not mentioning any names.
No, don't mention.
But so maybe actually there's some people foolish enough to say that mother's milk is not the right food for babies.
Right.
But that would be paramount to what I hear from some of the political candidates out there.
Yes.
But I'm not mentioning any names.
Let's not mention. Maybe someone that starts with a T or something. I don't know.
No. This is usually start with a C.
With a C.
Don't you dare put that kind of bias on our program. But,
okay.
It's unbelievable what you hear people say. Anyway, mother's milk is the milk that you're supposed to consume. Everybody knows that, and it is loaded with essential fat for the baby's brain, and it's always been right, and that's why we've had the Roman Empire, and that's why we've had, what do you want to name in terms of successful civilizations? Yeah, that's it.
Yeah,
there you go.
Dr. McDougall, here's a question. I myself eat a lot of sweet potatoes, and there's someone that has a question about that. He says that they have been eating a lot of sweet potato, and they prefer very well cooked in the oven to the point that the juices are bubbling out of it, and it's very creamy and sweet. Am I changing the starches into sugars that I need to worry about if they do that?
Well, you are changing them into more simple sugars by cooking. Anytime you heat a food, like for example, when you make a seen bread or Wayfarer's bread by slow heating sprouted wheat, you make it sweet tasting, because heat will denature the sugars, will break them down from more complex sugars to sweeter sugars. But that's okay. You love the sweet tasting sweet potatoes. We just talked about simple sugar in the form of pure white sugar in an article I just discussed with you 15 minutes ago. And here you're getting sweet sugar, simple sugar from a very healthy root vegetable. You could also worry about the sweet sugar you get from bananas or oranges or pears. But who's going to argue that simple sugar is bad for you? Only a fool would. Not even the Atkins people would argue that eating fruits are bad for you. I mean, at one time, Robert Atkins did, but the Atkins nutritional program now encourages the consumption of non-starchy green and yellow vegetables and fruits, because somewhere along the way they realized that eating a diet of bacon, butter, and brie was deadly, and that they had to change their message. Otherwise, someday someone would get on top of them and point out the fallacy of avoiding non-starchy green and yellow vegetables and fruits. So even the low carbers these days, those that I mentioned previously in this interview, as well as the Atkins nutritionals, they tell people to eat these things. So natural sugars are fine. I just told you in that article, read it. They won't make you fat. They won't raise your cardiovascular metabolic risk factors. They'll improve your mood. You'll lose weight, actually, as these people in this study did. Of course, this was a calorie restricted study, and that's one of the reasons they lost weight. But it didn't make any difference whether it was white sugar, table sugar they ate, or the starch they ate. Again, don't confuse the subject and think Dr. McDougall thinks table sugar is health food. I have to keep repeating myself because there are people out there that do spread bad rumors about me, and so what? At least you're talking about me. I mean, at one time I said you can write my name on toilet walls if you want, just as long as you're talking about me. Write my name on toilet walls.
Well, it's funny.
With my web address, not my phone number.
Right. This morning I was checking every now and then I get on YouTube and I check the webinars that you and I do, and there was someone that was saying something negative about what you said about sugar, and so I kindly invited this person to participate in one of our webinars. And I just think that if people write something negative, they should have the courage, we could say, to come and have a nice conversation. It won't, with you.
That would be okay, but there's some really kooky people out there.
Right. This was a biochemist, and
the biochemist would be fine. But I'll tell you some of the things I run into.
I know.
Make me understand why some of my mentors and some of my colleagues that I work with just won't deal with the public anymore. They just say, it's just not worth it to be on the internet, to go to the discussion board, to get involved, because it's so painful. The way people are they feel anonymous, and they feel that they have the right to say anything about people because of the internet. And I'll tell you how I deal with it. Is I plain and simple don't go to the internet. I wait for other people to write me and tell me about the bad things folks say. And if I want to read it, I read it. And if I don't, I just say no.
Well, it's like you said, it's so easy to hide behind the screen. I mean, there are things that we wouldn't say to somebody in person, and we just feel like we can type.
Well, I'd love to have a biochemist on, and I bet when we got done with our conversation, because I know the science, I bet when we got done with our conversation, we'd find that he may have a different point of view, but the truth is the truth, and you can't change that. The world is round. And it is burning in hell, and we got to do something to fix it.
We have to do something. Well, we are every week doing it. It is working. Dr. McDougall, I have a fun video. It's like 1.5 minutes that I'd like to show from your old times.
Oh, okay, good.
And then I would like for you to comment on this, because I chose this video because it's about a subject that you sometimes talk about, and I want to know, and I'm sure people want to know, if you can change your mind about this.
All right. Well, let me see if hopefully I can. I'll click the right button and I can hear it too.
Okay. Yeah. When the video starts playing, then you can click the little microphone.
All right. All right. Sounds good.
Okay. Just give me. Let's see here. I will set it up so that we can all watch it, and it should be loading in just a few seconds here.
Exercise is a really important part of a total health picture. You need to find an exercise that you really enjoy. I'm here out at the ocean, and this is where I really enjoy getting my exercise. I like swimming, I like skin diving, and I really enjoy windsurfing. Now, it's up to you to find something that you also enjoy. I mean, maybe it's dancing, could be bicycling, swimming, maybe tennis. But find that exercise that you enjoy so that you keep doing it every day, and you keep that exercise profile up in a part of your total health picture. Now, if you exercise, there are certain benefits. Some of them you know very well. For example, when you exercise, you burn calories. And those of us who are overweight, we lose excess weight easily by burning those extra calories. When you hit trim weight, you know what you get to do. You get to eat a lot more food when you exercise. And boy, do I like to eat. There are other benefits to exercising. For example, it keeps your body looking good, keeps you feeling good, relieves minor anxiety and depression. And your doctor is concerned about certain things that exercise benefits also. For example, your cholesterol will come down, and so will your blood pressure. And the total result of these things is that you will live longer and healthier. An exercise program should be started with some consideration as to what kind of shape you're in right now. For example, if you haven't exercised very much, you want to start out at a reasonable level. And then what you want to do is slowly build up so that you take and gradually get your body into the condition it should be in. So when you plan your daily exercise routine, pick something you really enjoy. And then start out at a level that's really comfortable for you.
That brings back a lot of memories, and that's my favorite sport, has been for 30 years. And that was me, by the way, on that board, not the surfboard, but the windsurfing board.
Right.
Also the lady running, that was Ruth Heydrich, who is one of our breast cancer survivors she was maybe it's been 40 years. A lady who had metastatic breast cancer back in, I think it was 82, I saw her. So that was her running on the beach. And, it's...
Have you changed that? Because sometimes you have mentioned how you don't particularly advocate.
Well, what I'm careful about
What do you mean by that?
What I'm careful about is people put focus in exercise as the solution to their problem instead of fixing the problem, which is the food. The other thing is I've had so many friends injured exercising, bicycling, sure. Almost killed. When I windsurf, I windsurf out of the Pacific Ocean, and when I fall in the water, guess what's swimming around me? The great white shark. I figure if they don't bite me the first time, they're not going to bite me. So I only worry about it when I fall in the first time. But I don't windsurf for health. I windsurf because I really, really, really love being out there on the water. Mm-hmm. And if you like to do something like bicycle or tennis or run, I mean, that's fine. But you have to understand there's a high risk of injury from all of these kinds of sports. And you shouldn't look at it in terms of that's how I'm going to regain my lost health. That's how I'm going to have some really good fun. But I'm going to do it at some acceptable risk. And every runner, every bicycler, every windsurfer, every surfer, every kite surfer, even everybody that bowls knows that they're taking some physical risk by what they are doing. But they do it because they like it. And enjoying life is important, and those risks are certainly reasonable. But if you just want your health back, then what you do is you eat good food and you walk around. Like that's what people are designed to do, is walk around. Chase your 2-year-old.
Right. Well, Dr. McDougall, I think we have to close this webinar because it's about an hour. And as usual, everybody, please send questions to webinar@drmcdougall.com. I will make sure that at some point we have them here in the show. Would you like to say anything else before we close, Dr.?
I just need to put out some possibilities for us to get together personally, and that is we have the Advanced Study Weekend, September 16 through 18. Right. We have amazing speakers. Dean Ornish will be there. We have all the young doctors that are for the future will be there. My son and Anthony Lim and Matt Letterman, Alona Paldi and Tom Campbell, and T. Colin Campbell will be there also. And we have some other phenomenal speakers that you've never heard before. So come to the Advanced Study Weekend. It's a weekend that will never be repeated. And if you can't come, we also we broadcast almost live on the internet for that weekend. Right. So you can sign up on the website. The other thing is our next 10-day program where I get to be a real doctor and I get to see patients is December of 2016. And then Mary has, boy, I tell you, she's sold out so many times, but she keeps being able to get a couple more rooms. And she has a couple more rooms for Kauai, which is the end of January. We're taking quite a few people to Kauai, but not too many. And the reason we're going back to the Sheraton Kauai is because it's the best food we've ever had on a McDougall adventure. So it's a great trip. Gustavo is coming both to the advanced study weekend and to Kauai with us. So not only do you get a chance to say hello to Mary and I, but you know, Gustavo's, as you well know, a very friendly, fun person to be with, and you'll get a chance to spend a little time with him.
Well, thank you. Yeah, I'm looking forward to it very much. And I'm looking forward to seeing you very soon, in less than 2 weeks in Santa Rosa.
Less than 2 weeks. Now's the time to sign up. There are direct flights into Santa Rosa from many destinations.
I know, very convenient, very convenient. Well, thank you again, Dr. McDougall. And
it was fun.
Next week, we have a guest, and it's Dr. Doug Lyle, and it's going to be a great webinar. So I want to remind everybody to go to your website and sign up for that. It's free.
Yeah. And I'll tell you, Doug's really excited too. He loves doing the webinars.
Oh, yeah. We were great by. Okay, well, goodbye, everybody. And good afternoon, Dr. McDougall. We'll see you soon.
It was a pleasure. Bye-bye.
Okay, bye-bye.